Welcome to the launch of the first ECHAlliance Ukrainian ecosystem. We launch a lot of ecosystems during the year, but this is genuinely an honor and a privilege to be able to do so with people from Ukraine. Since the war started, we have done what we can do as an organization to try to support Ukraine and, of course, the people of Ukraine. So just to be clear, we have quietly been making lots of connections, many of whom are on the call today, and we're thrilled to connect Ukraine now with our own global network of ecosystems, 75 plus ecosystems around the world. Andy will give a short presentation later to demonstrate the scale and size of that global community. We want to keep connecting Ukraine to the world because they want to know what's happening in Ukraine, want to know how they can help in Ukraine. And basically we do as well. So this is not a one-off. This is us pledging to continue to work with Ukraine for as long as it takes. And we feel very passionate about that. Even so passionate, in fact, that we actually changed our logo to the Ukrainian colors. It was originally blue. It's now blue and yellow, sorry. And that was quite a decision after 12 years of us running the ECHAlliance. But it's a very small way of demonstrating our determination to support you and inform our community who want to help as much as possible. So I say nothing more to that, and I'm going to hand over to Andy, who will lead us through a fairly packed agenda today. But I'm just thrilled to see so many people from Ukraine and indeed our communities around the world who are supporting this today. It's the first of many. Thank you very much. Andy, over to you.
Thank you, Brian. And welcome to all those people who just joined us. My name's Andy Bleed and I work for the ECHAlliance. We've got, as Brian has said, a very busy schedule for today's ecosystem. And as he said, hopefully the first of many to come as we partner with colleagues from the Ukrainian Clusters Alliance. Today, we're going to have input from the European Commission as part of their ongoing support for Ukraine. We're then going to hand over and hear from the Ministry of Health. And then we've got input from the Ukraine Clusters Alliance to showcase both the history, the internationalization, and also, we think, the way in which they've worked around building up that cluster network. And then, as part of that network of ecosystems, we're also going to hear from 3, I think, star ecosystems. Now, don't worry, they haven't paid me to say that. These are genuine ECHAlliance ecosystems within Wales, in Romania, and in Catalonia. We'll be recording today's event for those people who can't stay for the whole of it, but we hope to bring you that exciting picture from today and look for opportunities for collaboration over the coming years. We've been doing these ecosystem events now for over 12 years, and we're really pleased, as Brian said, to have our first Ukrainian ecosystem gathering. Right now, though, I'm going to hand over to a colleague, Cynthia, from the European Commission, who's going to detail some of the outline for us, some of the health security programs and the work of the European Commission. Cynthia, over to you.
Yes. Hello, good afternoon to everyone. I would just now start projecting. Let me just put this in full. I believe you can see now. That means I am Cynthia Menel Lemos. I am a doctor, epidemiologist working on the health security unit of the Directorate for Health and Food Safety. And we are supporting the Ministry of Health of Ukraine and Ukraine organizations I would say in several areas, because we are as well implementing the public health program, that is the EU4Health program. But I just want to bring your attention is that the legal framework for our activities is the regulation on serious cross-border threats to health, where we support the EU member states, EAA countries and participating countries of improving preparedness and response for crisis in health that can be from biological, chemical, or radionuclear events. And one of the priority areas is to reinforce surveillance to be able to detect and then create alert systems and respond in a coordinated manner. And since 2022, Ukraine has joined the EU4Health. That means Ukraine organizations can be beneficiaries of EU4Health funding, and we cover different priority areas. And I just bring to your attention I think one of the areas where we are working very closely is on the EU reference networks for rare diseases. And I know that in Lviv, in one of the hospitals, I think the hospital of reference for pediatric patients, the EU reference network has established a hub. One of the priority areas that we are working as well with Ukraine and is on how to tackle hospital-acquired infections that sometimes are resistant for antimicrobial agents. And I know that Ukraine was invited to participate on this action. We are working now in 2023 on the setup of direct grants with member states and participating countries for strengthening the surveillance system. And these are really like country-specific grants that can be developed involving different organizations. And that is to address I would say, the digital gaps. And this can be supporting infrastructure development, but as well developing capacity building or addressing legal aspects of sharing data between different data sources. Like we know that GDPR is a challenge for some organizations, and this can, I would say, promote the adoption of solutions based on pilot studies that could be developed. And this is something that is ongoing. I have put here the link. And these would be actions with competent authorities, but the competent authorities usually are government organizations, but they can involve other organizations from academia or from civil society organizations to participate on these grants. And here is an example of one of the joint actions that we are currently funding, that is the United for Surveillance, where we are focused on the detection of agents that have epidemic potential. And as you know, most of the epidemics that are occurring worldwide are zoonotic diseases. That means what we are trying is to bring together different data sources, like from hospitals or laboratories for outbreak detection, or hospital surveillance for identifying severe respiratory infections early enough that we can then identify ways of responding, but as well how to bring together animal health and human health databases to be able to detect outbreaks. That means what we want is to have a large joint action that will bring together the 27 EU member states, the 3 EEA countries, and the participating countries, that in this case is Ukraine and Moldova, that could have national grants working in same priority areas. Another thing that I would like to bring to your attention, that one of the areas where we support the Ukraine authorities is on medical evacuation of severe EU patients. These are patients that cannot have interruption on their treatment. That means these are mostly cancer patients or patients with serious chronic diseases that cannot have interrupted treatment and are life-threatening conditions. Several of them are trauma patients that are victims of the war, and we are bringing to the EU to be treated and then have access to rehabilitation in case of need. And what we told that together with the World Health Organization and with the support of the Foreign Policy Instrument, we are supporting hospitals in Ukraine how to better take care about the patients after they are discharged from the EU and EEA country hospitals. And we are trying to foster collaboration between the EU health professionals and the Ukrainian patients. And this would be bringing the patients for having in Ukraine the required treatment and care. And I think these are the ideas that we are proposing. And here you have the priority outputs of this project that is focused on trauma and war surgery. on burn care, on ICU treatment for critical care patients, and as well on how to ensure the rehabilitation and follow-up of care that would be adapted to the needs of the patients. And here you have the contact details of the group that is working with WHO and several NGOs on facilitating the return of the patients to Ukraine, but as well the delivery of the adequate treatment and care. Here you have my contact details. In case of need, you can always write to me. Thank you very much.
Thank you very much, Cynthia. Very, very good to get that overview, and I think important to see where already impact is being made from the European Commission and other partners too. Obviously we'll share those details as well, and the slides with material from today. So that's very much what we call a helicopter overview across Europe about the work within Ukraine. Now I'd like to formally invite or welcome the Ministry of Health, Deputy Minister, Marina Slobodnichenko. Please, the floor is yours, and my colleague will share some slides for you as well. Again, reminder for those people who need to switch between English and Ukrainian to change your channels now. Please.
Colleagues, thanks a lot, and I'll continue the conference in Ukrainian language. And first of all, I would like to thank the organizers for such initiative, and in particular to thank Tatiana Vorontsova. Thanks a lot for initiating from MOH this to actually join this meeting, because the thing that you are doing is very big, and joining different countries and different initiatives in the context of medical clusters is one of those things that presently Ukraine really needs. I will show you a presentation where I'm going to tell about two aspects. I'm going to touch upon a topic of European integration and EU for health from the political point of view, namely where Ukraine stands. But first of all, I would like to say that it has been very well said in the beginning about the war, because the war against Ukraine is presently a reality. We haven't chosen it, but we live with it. And we have to live in this reality, and we don't know how much long. But at the same time, this reality which we are in forces us to open new doors, to get together with countries, with the governmental and non-governmental organizations, and create such initiatives. And all this leads to new challenges and new development in our country. But also another very important thing is that the war has become a driver for our European integration processes. And now I'd like to bring to the slide this presentation. And I can't see it now, unfortunately. Can you tell me if
there's
the presentation
just a
is screen?
slight delay. We're just trying to get the slide back up.
Yeah, okay. While the presentation is being loaded, I'm still going to say that European integration, I mean, the war became a great driver for European integration, and with incredible efforts that we put into that, we're moving towards different European institutions and getting together with them. And I would like to thank, I mean, Cynthia, it's great to see that you are here, because we, I mean, the Ministry of Health is already closely cooperating with different institutions of the European Union, and I think that the topic of trans-border threats is one of the key ones that the MOH is now working with. So it's great that you are also involved in this communication. As for our interaction with the European institutions, we are planning, yes, great, but now I'm just going to say a couple of words about European institutions, and we'll do that for all participants of this event so that you understand how the ministry is moving in its interaction with the European Commission and the institutions, and maybe if this is going to be some sort of impetus for actions. Now we are arranging communication with the DGI Sante and European Commission, and we have just concluded a memorandum for public health development, and separately we are also going to develop such vectors, pharmaceuticals, and also clinical trials. I'm going to mention those a bit later as well. But coming back to the European integration topic, I'm asking to put on the first slide. This is, yes, the following slide, please. This is general context in the current state of Ukraine, where it's staying now in the field of European integration processes. We the four fields of this public health, pharmaceutical field, medical service, and medical education. Both medical service and medical education pertain, and public health as well, they also pertain to medical clusters. And these four fields, as I said, they have such topics as digitalization, One Health concept. One Health concept is also in particular very close to the public health topic. In Ukraine, we have two European integration directions. One is implementation of association agreement with the EU, because for a long time we have been implemented it. And in the field of MOH, we already have 71% of it executed. And another process that Ukraine has started without waiting for negotiations with the EU, without waiting for membership in the EU, we started independent implementation of directives. We started independently analyzing our legal acts. This is what other EU countries hadn't done. Independently, they haven't expressed this initiative. In health, we analyzed about 1,500 legal acts. We completed that process, and the following slide, I'm going to tell you a little bit what kind of challenges the healthcare system Ukraine now has. The following slide, please.
Here you can see the sectors that I have been just referring to. These are pharmaceutical, healthcare services, medical education, and public health. So in total, 318 EU acts, directives, and regulations need to be implemented. You can see that the largest number falls onto public health. But this is not critical because lots of technical indicators need to be implemented by us in this field, and hence this number. We have 16 regulatory acts in the field of healthcare services. This deals with transplantation and blood donoring, different activities that are associated with donating blood. As for medical education, there is one directive, but in fact, the Ministry of Health is not the constitution to transpose this directive for medical education. We prioritize other fields, but we still do not deprioritize it because preserving our hospitals and other institutions is important, and it is crucial to provide for proper working arrangements for our healthcare professionals, including physicians and others. So it would be really good if healthcare clusters cover not only financial incentives for our doctors, but also others, so that they could receive relevant experiences, knowledge, share knowledge with foreign institutions, and get together in different associations or teams in order to enhance свого досвіду, своєї
their
компетенції.
experience and
І
competence.
відповідно зі сторони держави
Accordingly,
ми вбачаємо необхідність
the
посилення
state
таких баз,
believes
які би
that
заклади
the
посилення
strengthening
інституційної
of
спроможності
these sort
закладів
of
охорони здоров'я,
facilities
оснащення закладів
basis
охорони
and
здоров'я, щоб ми
the
могли
strengthening of
стримувати
institutional
наших медичних
capacities
працівників, зацікавлювати їх
the
працювати
healthcare
в Україні,
facilities
але в той же час
would be
обмінюватися
important
досвідом з
to
іншими
encourage
країнами.
healthcare
Наступний
professionals
слайд, будь
to work
ласка.
locally, but also have exchanges with
Я дуже швидко
counterparts. As for the
пройдуся.
next
Наступний.
slide, can you please switch to the next slide?
Це наші плани на майбутнє, які до кінця цього року. Наші плани полягають в тому, що на рівні регуляторного органу, на рівні Міністерства охорони здоров'я України ми маємо розробити програму за результатами селф-скринінгу, в якій передбачимо поетапне впровадження європейських директив і регламентів. Це не тільки законодавча робота, це також і робота відносно імплементації процесів і найкращих європейських практик. І от, до речі, дуже слушно говорили про питання, про програму Єврофохелс і про можливості, які дає програма Єврофохелс. І от, власне, регуляторні процедури, які можна передбачати в подальшій національній програмі імплементації законодавства, вони можуть стати, проекти Єврофохелс можуть стати частинкою такої національної імплементації, тому що в тих програмах Єврофохелс передбачаються і закладаються також регуляторні процедури, які потрібні для України на сьогоднішній день, і посилюючи ті регуляції зі сторони інших країн, отримуючи підтримку консультативну, це може бути дуже суттєвим для України. Тому на сьогоднішній день Україна знаходиться ось серпень місяць, це звіт, який ми маємо подати за результатами нашого селф-скринінгу із проектами, які ми повинні розробити, і до кінця року ми повинні розробити національну програму імплементації всіх актів Європейського Союзу. Такі серйозні виклики перед нами зараз стоять на шляху до євроінтеграції. Будь ласка, наступний слайд.
You agree, the next slide, please. These refer to the challenges that we are currently facing.
Трішки про Єврофохелс.
And just
Я дуже дякую за те, що згадали цей проект.
I'm very grateful that this project has been
дійсно стало важливим зрушенням для України.
It was an important move forward
для
for
наших
Ukraine.
слухачів на сьогоднішній день
And
я
for
не
our
зупинятимусь
listeners
популяризувати
attending today,
цей проект
will
Єврофохелс
not
і не зупинятимусь розказувати про нього. Трішки цифр.
In order to
5,3 мільярда
popularize
євро – це загальний бюджет програми Єврофохелс до 27 року.
Just a few figures.
4,6 мільйони євро – це бюджет, який схвалений для України по тим проектам, які вже є 22-23 рік.
4.6 million euro is the budget of
Гранти
EU for
прямої
Health
дії, які
projects
отримала
as
Україна
already
вже,
approved for
це
Ukraine
Центр
under
громадського
projects
здоров'я 5
for
грантів, Український центр
2022
трансплант
and
координації 1
2023.
грант,
So grants
електронне
of
здоров'я
joint
1
action
грант,
will
Державний
be implemented
експертний
by
центр на
the
навчання
National
наших
Public Health
інструкторів
Center
1
5
грант,
grants and
і
the
Охмадит також 1
Transplantation
грант. На
Coordination
жаль, він не є
Ukrainian
фінансовий,
Center 1 grant,
але просто правом
e-health state-owned
участі
enterprise 1
лікарям брати
grant
в певних
and
програмах обміну
the
досвідом,
state
але
expert
не
review institution 1 grant
фінансовий
and
грант.
also the main kids
Напрямки,
hospital
ви на
will
цьому слайді
have one
презентації можете побачити
grant, although it is not
напрямки, в
financial, it's
яких
on different
було
subjects.
здійснено
And on the slide, you can also see what areas are covered by EU for Health for Ukraine.
профілактика
They
діабету,
include
профілактика
prevention of
моніторинг
CVDs and
онкозахворювань, посилення
diabetes,
інфекційного
then prevention
контролю,
of oncology diseases,
діагностика
strengthening
рідкісних
of
захворювань і обмін
non-infection
досвідом між
diseases
країнами,
control, then
навчання наших
strengthening of
фармінспекторів, це,
infection
власне, те, про що
control,
говорила Державний
then
експертний
improvement
центр,
of
отримав
diagnostics of orphan diseases, and
впровадження
also
європейської
strengthening of our
системи оцінки
human
безпеки
resource
resources. This is for the state experts review center, then strengthening of the blood system, also strengthening of the system for epidemiological surveillance and related transborder threats. And I'm grateful to Cynthia for touching on this topic. Also, it deals with interaction between EU countries for joint development of priorities, objectives, and actions. And the next slide, please, now.
В нас є певні плани. Буквально нещодавно Центр громадського здоров'я, який, в принципі, є лідером в Україні в розвитку програми Europe Health, проводить вебінар. Цей вебінар, до речі, є в вільному доступі, і можна його отримати і проглянути для тих учасників з України, які зараз нас слухають, але й не лише, також для тих учасників, які перебувають за кордоном. Я вас агітую, закликаю доєднуватися до програм неурядового сектору. До 17.07.23 року в Україні буде відкритий відкрита подача грантів на програму Europe Health. 20 мільйонів євро загальний бюджет на 23 рік,
20 million euros is the total
і
budget for
12
2023,
напрямів
and there are
для
12
неурядових
areas
ініціатив. До речі, ці
for
12
non-governmental
напрямів я зразу
initiatives are
хочу
in place.
звернути вашу
And here
увагу,
I would like to draw your
що це ті
attention
напрями,
to the fact that
які мають
these are
посилювати
the
гранти
areas
прямої
that are
дії,
supposed
які вже
to
отримала
strengthen
Україна.
the direct
Тобто на
action
попередньому
grants
слайді
that
ви
have already
бачили
been received
напрямок, по
by
яким
Ukraine.
Україна вже
We saw
отримала
them
гранти
on
прямої
one of
дії.
the
Будь ласка,
previous
доєднуйтеся
slides. So
до
Ukraine has
наступних
received
проєктів.
those grants,
Це
so
можуть
you are
бути
welcome to
і
join
заклади охорони
those
здоров'я,
further
неурядові громадські
projects. They
організації,
go
науково-дослідні
for
інститути.
R&D
І
institutions, cell-site
такі
organizations, and
можливості
healthcare
є
facilities.
дуже
And
важливими
these
для
opportunities are
українських
indeed
закладів охорони здоров'я,
crucial
неурядових
for
організацій для того, щоб
Ukrainian healthcare facilities and
посилювати
non-governmental
свою
institutions
спроможність.
for them to
Якщо
improve their capacities.
ви, до речі, на цьому слайді можете
By the way,
побачити,
on this
на
slide
які
you
напрями.
can
Це і
see
ментальне здоров'я,
areas
і
that are
профілактика і
covered.
контроль
They include
неінфекційних
mental
захворювань,
health, then prevention and control
рівний
of
доступ до медичної
non-communicable
допомоги,
diseases,
боротьба з
then
онкологією, вже про це
access to
сьогодні говорили.
healthcare,
І
then the
така у
combat
мене до
against
вас порада,
oncology.
хто мене
So my
зараз
piece of
слухає, будь
advice
ласка,
to you,
звертайтеся до
to
Міністерства
those
охорони
who are
здоров'я,
listening to me
можете
now,
запитати безпосередньо мене, я
please
відкрита
ask
до
the
комунікації
Ministry of Health and me directly, as I'm
LinkedIn, Facebook, будь
open for
ласка,
communication in Facebook
це
and
можете
LinkedIn.
сміливо писати.
Please feel
А
free
взагалі
to
я скоординую
write
вас
to
на Центр
me,
громадського
and
здоров'я, де є
I will
координатори,
be
які
happy to
працюють і
coordinate
зможуть
you
проконсультувати і
and put in
розказати, яким
touch
чином
with
податися на
the National
відповідні
Public Health
гранти.
Center,
Моя
where
порада
professionals
для
would be able to tell you
слухачів наших
how
в тому,
to
що
apply for those grants and
не
so on. And my piece of advice to the
бійтеся
listeners
об'єднуватися
is that you should not
консорціумами
be
і не
afraid
бійтеся
of
шукати такої підтримки
going
і
into
об'єднуватися в
consortia,
консорціуми
and
за
please
кордоном.
be not
Дуже
afraid
важливо,
of
щоб в такі
making
гранти
up
можна було входити
consortia
спільно
with foreign
компаніями,
counterparts. It would be
групами
important
за
to
підтримки.
go
От,
into those
власне,
calls for
кластерна
proposals
система, робота
as
кластерів, я
groups,
думаю, що тут
as
могла би зіграти дуже
teams, and
важливу
actually the
роль.
cluster system and
І
framework
стала
would
би таким
play an important
підсилюючим
role
інструментом на
here
сьогоднішній день для
and become
України і
a
саме для тих
strengthening
лікарень,
tool for Ukraine
які,
and for the very hospitals
можливо, десь
that
хвилюються, що вони самостійно
could
не
be
справляться
somehow
з подачею на такі
concerned that
гранти.
they would not cope
Тому
with that
моя
when
така
they
порада, будь
apply
ласка,
alone
об'єднуйтесь, для
on
вас
their
гарний
own.
інструмент
So that's an advice to you.
зараз є
There
ось,
is a
власне, в
nice
цьому вебінарі.
tool.
Так
As
що
part of this very
дякую вам
webinar,
за
there
те,
is
що
a nice tool to
даєте
do so.
можливості
So I'm grateful
доєднуватися
for
до вебінару, вашим
this
слухачам.
opportunity
Всім
to
бажаю
join
гарного дня і удачі,
webinars for
і
this
відкрита
webinar
до
to be
вас
joined by
для
listeners and
комунікації
all good
подальших.
luck to
Дякую.
all present and thank you for your kind attention.
Thank you very much, Marina. It's important to emphasize the value of having a network of people who already are involved with some of these EU for Health programs. So we've got a network of other countries that are already taking part in these, and we welcome the involvement of Ukraine. We, for instance, already have our first European funded program with Ukrainian partners on a cancer call. And we look forward to that being one of many, and I'm sure other colleagues who will speak later on from different countries as well will welcome that willingness to get involved, because that's the value of having this network. So thank you for your messages there, Marina. Very important, and hopefully explains a little bit about some of the opportunities around internationalization, as well as some of the need. So I'm going to go down, if I can, straight over to Alexander Yurchak, who's going to give us a brief overview of the history of the Ukraine Clusters Alliance. And Alexander, the floor is yours. Just make your screen nice and full screen.
Yeah.
Wonderful.
Thank you, Andy. Колеги, вітання. Дякую за цей вебінар.
Yes,
Насправді дуже важливий
colleagues,
для
greetings, and thank you for
об'єднання
this webinar,
наших
which is
медичних
important
кластерів з
to join
європейськими, з
our
європейською
healthcare
екосистемою, з
clusters
ECHAlliance.
with
І
the
особлива
European
подяка ECHAlliance
framework and
за підтримку,
ECHAlliance,
за
and a special
приєднання
thank
великої
you to
європейської мережі. Ми
ECHAlliance
це відчуваємо.
for
І я про це ще
support and for the
скажу
possibility to
трішки
join
далі.
the European network. I
Кілька
will
слів
dwell
про
on that
наш
a bit
український
later.
кластерний альянс.
Just a couple of words on our Ukrainian cluster alliance.
Бізнес-об'єднання
This
серед
is quite a
великих
new
бізнес-об'єднань України. Ми створилися
business
в березні
association.
минулого року.
We were
Можна сказати,
incorporated
що
in
війна
March
об'єднала
last
кластери
year. It
України,
could be
оскільки
mentioned that different
ми
clusters across
дійсно
Ukraine have got
об'єдналися,
united,
мобілізувалися в перший
and
місяць
indeed
для того, щоб
we
допомагати
united
критичним
and
індустріям,
got
серед
together
яких була
in order to
також медична
help
галузь.
critical
Загалом
sectors,
кластер, як ви
including
знаєте,
the
фокусується на
healthcare one.
ланцюгах доданої
And as you
вартості,
may know,
тобто як
clusters
покращити,
are
як зменшити
banking on
розриви,
value-added
як покращити ефективність, і
chains
друге, це,
and on
звичайно,
improvements
зв'язку з
of
інноваційними
efficiencies. And
екосистемами,
of
як
course, the
зробити
second
наші
point is
ланцюги
innovative
будь-яких,
systems.
але також
This is
сферах
how to
послуг,
make
на
our different
будь-яких
chains
послуг,
more innovative,
більш
whether it is in
інноваційними, більш
services
стійкими,
or
що
elsewhere,
дуже
how
важливо,
to make them more
особливо під
innovative
час криз.
and
Таким
so on,
чином,
which
сьогодні
is
ми маємо в кластерному
extremely
альянсі
crucial, especially
60, вже трішки
in
більше
crisis.
кластерів.
So we have
Ви
a bit
бачите,
more
як
than
вони
60
згруповані, і
clusters in our
за
alliance. Now you can
галузевою
see how they are
ознакою найбільші
grouped
такі
by
пули
sectors.
кластерів у нас
So the
мають
largest
власні
pools
ресурсні
of
центри,
clusters,
зокрема
sort
ресурсний
of
центр
resource
медичних
centers,
кластерів, очолює Тетяна Воронцова.
and
Велика
this
і подяка
includes
за
the
роботу, яка
medical
вона
one
робить, зокрема в
led
організації
by
цього
Tetiana Vorontsova. Great
вебінару.
thank you
І
to her
також ми
for
маємо
the
такі
work that she's
крос-секторальні, тобто
undertaking,
які
including the
стосуються
organization
багатьох
of
галузей.
this webinar.
Ресурсні
And
центри
also we
це
have
індустрії
cross-sectorial
4.0,
ones
розумні
that cover
регіони,
different
розумні
sectors
міста і
in
технології
the industry
подвійного
4.0,
призначення.
5.0, then smart regions,
Власне,
smart
для
cities,
лікарень, оскільки Тетяна не
and
сказала, що є певний
as for
такий,
the hospitals,
ну, як
as
виклик, чи, можливо,
Tetiana
навіть не
mentioned to
розуміння,
me,
для чого
there
потрібні
is
кластери
a
лікарні.
challenge or even lack of understanding
Скажімо
as
так,
to
що
what
кластери виконують головним
hospitals are
чином
needed
три такі
for
ключові
from
ролі.
the
Вони
cluster
об'єднують
perspectives.
в
I would
першу
say
чергу,
that
звісно, малі і середні
clusters
підприємства, це якщо
join
говорити
first
про
and foremost
промисловість, але
SMEs
не тільки,
in
звичайно,
industries,
МСП, це також
but of course not
ну,
only those
будь-яких
small and medium-sized
акторів
enterprises, but
от, економічних
also
секторів, які
any
створюють там
actors in
товари
economic
чи
sectors
послуги.
that
Вони їх
deliver
об'єднують, і в нас багато дуже
goods or
прикладів, як
services.
ці об'єднання
So
дали
they
потужний
join
такий
them, and there are multiple
поштовх,
examples
допомагали
how
учасникам
those
регіонів
amalgamations
справлятися з
gave
викликами
a
війни.
mighty push
Зокрема, ми бачили такі
and
приклади в
helped
швейній
to
індустрії,
overcome
легкій промисловості.
challenges.
На
We
початку війни
saw such
кластери
examples
мобілізують
in
своїх
the
учасників
sewing industry, in
відповідно
the
до
light
викликів,
industry.
які вони бачать. В
So
першу чергу ми
the
говоримо про
participants get
закриття
together
розривів
based
в
on
ланцюгах.
challenges,
І в нас
and
так
they
само
cover
на цю
gaps
тему досить багато
and
прикладів
disruptions in
в кластерному альянсі.
those
Ну і кластери,
chains. And we
звичайно,
have got lots of such
координують
examples in
багато дій своїх
the alliance. And
учасників.
of course,
У нас
they also do
буквально
coordinate lots
тиждень
of
тому
activities with their
відбулася
participants.
конференція
It was
по
as
індустрії
early as
5.0, куди
last
залучались
week when
багато
we
учасників
had an event dedicated to
кластерного
industry
альянсу, і ми, от,
5.0.
наприклад, елемент
Lots of
координації, це
participants
коли
from
ми
the
спільно
alliance
продукуємо якісь
got involved,
пропозиції
and
для уряду.
we jointly come
Або
up
ж
with some
інший
proposals for the government.
приклад
And
координації, це
also
коли
another
кластери
example of
виходять своїми
coordination
пропозиціями
is
на рівень
when clusters come up with their
регіональних
proposals on
об'єднаних
the
громад або
regional
місцевих
territorial
адміністрацій,
communities
і таких
level
прикладів
or on the level
у нас
of
теж багато.
local public
Один з
administrations. And we
найважливіших
have
напрямів
multiple such
діяльності
examples as
УК
well.
це
One of the most important
інтернаціоналізація,
area
і, власне,
of
чому ми
activities
партнеруємо
is
з
internationalization. And
ECHAlliance і
this
з
is
багатьма
why
іншими
we
учасниками європейських
are together
екосистем
with
і
ECHAlliance
галузей, і на
and
рівні галузей.
also lots
У
of
нас є
other
своя програма
European
інтернаціоналізації. Я думаю,
actors
Оля
on the sector
Трофимова
level.
ще
I
далі
believe
трішки
that
більше
Olga
розкаже
Trofimova
про заходи,
will
які ми
tell more on
проводимо.
our
Але якщо коротко,
internationalization
для нас дуже
agenda
важливим є в цій
and
програмі
our activities that we carry out. But here in brief, European integration is crucial for us. This is about European and innovative ecosystems that we have a chance for and that we integrate into. And I advise all representatives from government bodies and regional administrations to take a look into the strategy on the internationalization. And my usual message to foreign counterparts is about our needs and what Ukrainian clusters are looking for. So first, we have around 50 projects of our own. They deal with the resilience, and you can take a look into a dedicated web page on those. Of course, they're pretty well known. And also Marina Slobodanyuk, the previous speaker, mentioned that we do need a stronger collaboration in innovative and other, say, Horizon Europe, Digital Europe projects, and given that we have a certain delay in terms of sectors and our participation. Also, we kick-started mighty coordination as part of Eastern European programs that have already been mentioned today too. And of course, we are very interested in regular exchanges of experience and best practices as regards the so-called dual transition, which we consider one of the largest challenges for our clusters and for our members. This is how to strengthen our ecosystems and infrastructure development, how to speed up the development of clusters, how to improve technologies and sustainable development, and naturally programs on training and skills improvement. You can take a look into the web page mentioned where all those things are mentioned. Speaking of our plans or ambitions, we are very much interested that the projects that are being developed by our clusters now be integrated into governmental programs on recovery. And we are talking about sustainability and resilience now. You can see now lots of projects that deal with various sectors, including the healthcare one. And we are cognizant that accelerators and incubators of their own kind are required for the health sector. The same deals with industry roadmap. We are referring to circular economies, standardization, digital transformation, and other things. So these projects are present in our portfolio, but the question and the issue is to coordinate them with government and find funding, because regretfully such projects are hardly funded in Ukraine. And of course, a separate thing is the one that was triggered by the war, and we are here united around the programs on rehabilitation.
Very briefly, I'll just mention one initiative of internationalization that is now very quickly and very rapidly developing. It is called Professions for Ukraine. It joins, we call them ambassadors, of those professionals of the world who help us implement those various projects, and actually they themselves make some initiatives. So we don't even ask them really. Like, for example, Teresa Shamanova from the Czech Republic. Since this year, she organized 3 business missions of our clusters in the Czech Republic, in Czech Ukrainian forums by different topics. And also the travel expenses are paid for Ukrainian colleagues by Czech government. Then there is also the organization of a series of business meetings and joint missions for Ukrainian and Polish clusters. Also, there is the German, which is the creation of new clusters. So these clusters could develop more quickly. And this list is rather long. We have 10 or 12 people like that. I'm not going to mention all of them because it's going to take too much time. But yet again, we really appreciate the help of international community. And again, the ambassadors partners are those professionals who regularly and systemically provide us a rather significant amount of assistance. They do it voluntarily and without any coercion from our side. Normally, we just helped them to coordinate some activities with our clusters. I'm very happy to announce today that Brian O'Connor and Andy Bledden today have also become the ambassadors in our program, Professionals for Ukraine. And these things like integration into digital ecosystems of public health, they are very important for us, for those rehabilitation programs that I have just mentioned. And I would like to sincerely thank Brian and Andy for their efforts, because for more than a year we've been communicating, exchanging, and planning, and we feel their regular support. I think that all clusters now applaud you and also are grateful to you. That's it from me. And if you have more questions to me, please write them on the chat. Again, we're very happy and I will be grateful to see hospitals and other participants of the market of the healthcare and medical services to our medical clusters. Thank you.
Okay, thank you very much for that, Alexander. Very, very informative. And it gives us an overview of the Ukrainian Clusters Alliance. I want now to go and do a deep dive, okay? And I'm going to do a deep dive into the medical clusters. And I got no one better to talk than Tatiana, who will give us a guide to medical clusters in Ukraine, both past, present, and future. No pressure, Tatiana. Over to you.
Hi everybody, доброго дня. Зараз я налаштую
Good afternoon, everybody.
презентацію.
Now I'm going
Скажіть, будь ласка,
to
чи
turn on the
добре
presentation.
видно?
I hope that everyone sees it.
Зараз я зроблю її.
Yes, just make it full screen.
Я не можу це зробити.
For some reason, I can't do that. Maybe like this.
I suggest we go with it as it is.
Так, десь поділася, от воно все. Ні. Цікаво. Доброго дня, колеги. Я буду презентацію робити українською, тому що більшість нашої аудиторії – це саме керівники департаментів охорони здоров'я, головні лікарі або директори лікарень, директори підприємств, освітніх закладів, бізнесу, всі ті, хто сьогодні зібралися і хочуть розібратися в питанні, а що ж таке медичні кластери, чи вони вже існують, що вони роблять і яку користь можуть принести для кожного із вас. Тому ми можемо сьогодні заявити про себе так голосно разом з Міністерством охорони здоров'я, разом з Єврокомісією, разом з нашими партнерами, з нашими добрими друзями з Європейського альянсу охорони здоров'я, а також з представниками найбільш потужних медичних кластерів, які поділяться далі з нами своїми здобутками. А ми ж розкажемо про медичні кластери, які існують в Україні. Я не буду довго затримуватись на самій... Бачите, не можу порушити. Не можу перейти на наступний слайд.
For some reason, I cannot move to the following slide. Something has happened.
У вас зліва є панель,
On the left, you have a panel.
Так,
click on number 2.
Yes. Він не переходить.
Yeah, for some reason, it just doesn't move. I know. Tatiana, just, get out of the program and just enter again. It normally happens. Okay, I'll try that. Maybe in the beginning you could just open the full screen and then you could start the demonstration. Yes, like this.
Thank you, Olga. I see you talking. I can see you speaking.
Минулого разу добре це вийшло.
Last time it all worked well, but this time. Tatiana, first, just put it on full screen and then share your screen. Everything is good. You are going to manage. Yeah, but still.
Який на весь екран би його зробив. Давайте.
There isn't anything who could
Зараз
do.
має
Yeah,
бути.
full screen. Now it
Вже
should be
розширила.
there. I have already shared it. Okay.
І тепер вже воно сховалося.
It has already hidden. Okay.
Так, ще раз.
One more time.
Перепрошую, але якась
I'm sorry,
технічна
but there is some
проблема, що
technical
я його не
glitch
можу, я його
Take
that I
your time.
cannot open it.
Take your time. Something's happening. There we go.
That's me. I can share your skills for you, so Tatiana, you can just tell me next if you want.
Добре. Давайте
let's
тоді
do
за
that.
мене це зробіть.
Yeah, let's do
Перепрошую,
it for
бо
myself. I'm very
реально
sorry
щось таке сталося.
because really something happened. I
Якщо
don't know
мене
what.
видно, чути презентацію,
Can
тоді
you
я
see me
продовжу.
and hear me? Then I'll continue. Okay.
Yes.
Так, колеги, я тоді знову ж таки з браком дуже часу не буду зупинятися на тих передумовах. Ви їх прекрасно всі знаєте, чому виникли ці передумови створення медичних кластерів. Тому що медицина змінила свої основні законодавчі акти, перейшовши до створення від простої лікарні до комунального некомерційного підприємства. Тобто це зовсім інший формат фінансування і зовсім інший формат управління лікарнями, який може бути зараз в Україні. Звичайно, такі лікарні шукають колаборації як внутрі регіонів, так і поза регіонами, для того, щоб знаходити фінансування і для розвитку, і для мотивації, як сказала пані Марина Слободниченко, для того, щоб розвивати свої лікарні. Наступний слайд. Звичайно, і Україна збільшила свою інформаційну присутність. На жаль, через війну дійсно всі в світі знають Україну, де ця країна зараз знаходиться, але не дивлячись на ті виклики, які є зараз в Україні, Україна розвивається і прагне ще більше розвиватись, впроваджуючи нові, абсолютно нові інноваційні підходи в галузі охорони здоров'я. Звичайно, ці нові підходи – це і сучасне навчання професіоналів, як лікарів, так і середнього медперсоналу, для того, щоб їхні навички були на високому рівні, як світові. Звичайно, і необхідність того, що повинна розвиватися цифровізація в охороні здоров'я України, а також деяка нерозвинутість напрямків, таких як реабілітація, паліативна, хосписна допомога. Також необхідність посилювати енергоефективність наших закладів охорони здоров'я і обмінюватись досвідом з різними країнами. Все це стало передумовами для того, щоб лікарні на певних територіях об'єднувалися в такі громадські організації. Наступний слайд, будь ласка. І коли... Так, наступний.
Next slide.
Також, як говорили всі наші спікери українські, війна стала таким ще більшим викликом для нашої всієї системи охорони здоров'я, де є території, де зруйновані абсолютно у нас лікувальні заклади, і потребують відновлення не просто відбудови того, що було, а відновлення більш сучасного, інноваційного вже тих приміщень. І також впровадження нових методик і обладнання для того, щоб рівень надання допомоги вже був на рівні європейського світового. Наступне. Для того, щоб... Наступний.
Next, please.
І для того, щоб легше було комунікувати і розробляти ці проекти, медичні кластери, ці громадські організації певних територій, я вам зараз покажу, які це, вони, створившись, об'єдналися в ресурсний центр. Тобто ресурсний центр Українського кластерного альянсу медичних кластерів – це такі об'єднання медичних 6 медичних кластерів в Україні, які допомагають в розвитку взаємодії і досвідом
and experience between the members of these medical clusters. This is between the hospitals, between businesses, and between education, between the authorities, so that we could find joint new solutions to the challenges that exist. This is development of common projects, the ones discussed today or others, which are now available for the country. Naturally, there's also development of collaboration inside Ukraine with international partners as well. Also development of innovations, production, and research development, cooperation between medical devices producers and hospitals, also forming joint needs of the field in the current context and forming projects, which Alexander Kirchak has mentioned. The following slide, please. Next slide. Now about the resource center itself, you see on the map, that's the Ukrainian map, and these are 6 medical clusters which already exist in Ukraine. There's Lviv medical cluster, Rivne inter-regional cluster, Vinnytsia. We also have a cluster of equipment building, and also it has a medical block. There is one in Kyiv, a medical cluster for producers of medical equipment. In Kharkiv there is a medical cluster, and a Dnipro medical cluster. So all these medical clusters, they already have existed for some time, some for years, some even more, and they joined their territories, hospitals, and also private, including private clinics or public clinics, depending on which business, education, different institutions, different organizations that work in the field of healthcare. Following, please.
Наступний, next, please. Ще раз, ви бачите, що це лікарні, бізнес, університети, асоціації, спільноти і виробництво.
Communities and production. The following, please.
Що ми вже зробили? Іде наш перший крок. Дійсно, дякую Енді, дякую Брайан, що ми стали членами Європейського Connected Health Alliance, який дозволяє нам представляти наших членів кластерів, наші лікарні, їхні впровадження, їхні потреби, їхні інновації на 74 країни світу. Для цього ми маємо доступ до щомісячного такої новинної платформи, яка є у Альянсу, і можемо розміщувати там інформацію про якісь інновації або пошук партнерств. Також ми маємо можливості для знижок і на участь у різних заходах, інформація, яка є у цього Альянсу. Також є додаткові можливості. Це участь в багатьох проєктах, які фінансуються Європейським Союзом завдяки створенню консорціумів. Те, що говорила Марина Слободніченко, що дуже важливо зараз створювати, не боятися нашим лікарням, незалежно від форм власності, створювати ці консорціуми. Ми можемо це реально допомогти в цьому, маючи такий тісний зв'язок з різними країнами світу. Також в Альянсі існує така обсерваторія здоров'я, де розміщується певна інформація по цифровізації, про тих інноваціях, що є в світі в галузі охорони здоров'я.
Next slide.
Також ми були членами, учасниками в жовтні в конференції Європейської кластерної конференції, де мали контакти з багатьма медичними кластерами Європи, Франції, Німеччини, Прибалтики, Польщі, які готові ставати партнерами в консорціумі і вирішувати і проблеми, які є нагальні для України, і як для всієї Європи.
And which are relevant for Europe as well. Next slide.
Також хочу відмітити Монсі, яка також сьогодні буде мати доповідь. Це супер жінка і керівник напрямку інтернаціоналізації в медичному кластері з Барселони Біака. Ми мали чудову зустріч по обміну досвідом, по обміну, як влаштовані медичні кластери в Барселоні. Я думаю, що сьогодні вона більше про це може розказати. І дійсно це дуже важливо використати цей досвід, який є 20-30-літній в Європі для українських медичних кластерів, які тільки будуються, які створюються для того, щоб розвивати екосистему охорони здоров'я.
Develop a health ecosystem. Next slide.
Що ми основні наші проекти, які ми визначили як самі основні для наших медичних кластерів, які існують, це тема реабілітації. Тобто ми об'єднуємо партнерів реабілітації, які починаючи від виробництва, тобто виробники різного обладнання, імплантів, або ж виробники протезів, інноваційних протезів, до самих центрів, де проходять реабілітацію люди, які постраждали від війни, або взагалі ті, які потребують. Не тільки фізичну реабілітацію, але й психічне здоров'я, mental health, яке відомо зараз, які потребують фактично не тільки люди, які є фізично травмовані, але всі фактично українці, тому що 1,5 року ми живемо в повномасштабному такій війні, де кожен українець відчуває на собі цей вплив. Звичайно, дуже важливо це тренування мультидисциплінарних команд, тому нам важливо саме обмін досвідом і можливість такого тренування, стажування для наших фахівців за кордоном, обмін досвідом, тому що і українські фахівці мають вже дуже величезний досвід по реабілітації, особливо військовослужбовців, і ми можемо цей досвід дати для європейських країн. Звичайно, ми хочемо розвивати далі подовжену реабілітацію, використовуючи державно-приватне партнерство і розширюючи мережу тих центрів, які би могли надавати подовжену реабілітацію по всій території України. І хочемо створити таку інтернет-платформу, агрегатор для того, щоб полегшити шлях надходження людини, яка шукає реабілітацію, і тим центрам, тим програмам, всім, які існують в Україні або за кордоном, для того, щоб надати їм цю інформацію безпосередньо, щоб люди змогли сконтактуватися і дуже легко знайти можливості. Тому це, якщо коротко говорити про саму цю тему реабілітації. Наступне. Також дуже важливим темою, яку ми об'єднали, яку ми хочемо пропагувати, це створити систему підготовки цивільного населення до дій в надзвичайних і терористичних умовах, загрозах і воєнних діях, тому що ми переконалися за цей час, що ця інформація, ця тема дуже є важливою для кожної людини, і вміння надати сам собі допомогу, врятувати своє життя є дуже важливо. Ми маємо членів наших кластерів, які мають досвід біля 9-10-річний в навчанні, тренуванні як цивільного, так і військового населення, тому ми хочемо створювати такі інноваційні тренінгові центри з допомогою VR-технологій, доповненої реальності, віртуальної реальності, які допоможуть посилити цікавість людей до навчання і для того, щоб наша система, наше суспільство було більш підготовлене до викликів, які можуть зараз також зустрічаються в Україні. І що стосується цього проєкту, то разом з польськими партнерами ми готуємо заявку на інтерес, на подачу на транскордонне співробітництво.
Next slide, please.
Завершуючи свою доповідь, я хочу ще раз подякувати Європейському конектору Альянсу охорони здоров'я за можливість, за поштовх до такого лончу нашої такої цифрової екосистеми охорони здоров'я. Друге, я хочу подякувати дуже Міністерству охорони здоров'я, Марину Слободніченко і першому заступнику міністра Сергію Дуброву, який також був дуже зацікавлений в темі розвитку медичних кластерів. І також хочу подякувати своїм колегам з Українського кластерного альянсу, які дуже багато роблять для того, щоб просувати, зближувати Україну з Європою, Європу з Україною. Також хочу подякувати всім нашим учасникам, які будуть виступати з європейських медичних кластерів, які поділяться саме досвідом. І що хочу порадити або запросити тих учасників, які ще не є членами медичних кластерів.
I would like to call on healthcare institutions, and institutes who are not a part of clusters yet. You can find all my contacts here in the presentation and also in LinkedIn, and we can support you in joining forces in experience sharing programs. We can also summarize some topics that are of concern for hospitals in a certain region, and then we can come up with a summarized standpoint so that we could come with a joint standpoint as to say legislative changes and from the perspective of the reform of a capable network. A healthcare cluster is thing that joins businesses, hospitals and others for the sake of building up a health system for the benefit of all of us, for all citizens, so that a person could receive healthcare when needed, as needed, so that we could have a system built up in order to encourage healthcare professionals in a non-financial way, so that they could have development and see a prospect for the profession and advance our Ukraine, our healthcare system, and also taking and bringing in the best things from Europe, and also sharing the experience that it is present in Ukraine as regards dealing with those dreadful wounds and injuries that are present in our people, in terms of rehabilitation, in terms of training personnel, and we have lots of things that could be shared and could be given by us to Europe. So I'm welcoming everyone. I'm urging everyone to find me on LinkedIn, Tatiana Vorontsova, and write to me, and then we'll be building up that thing all together. Thank you.
Thank you, Tatiana. I can only agree with Tatiana. Contact her on LinkedIn or via email. You'll see pictures of her all over LinkedIn in terms of visiting places like Catalonia, etc. I think there's a fantastic opportunity here to connect some dots, because Tatiana, you're correct. There's much to bring in from outside of Ukraine, but I also, as we've spoken about in the past, think there are fantastic examples from within Ukraine, what you've done around digital health, about health records, etc., that many countries are paying attention to, because you've managed to leapfrog and make up years on countries that are still struggling because of the invasion. You've had to accelerate and change at pace within your medical clusters, and I think there's some fantastic opportunities there. So let's connect some dots here, because conscious of time, we've got a few more speakers to go. I'm going to talk a little bit about the ECHAlliance. The lesson here is it's the ECHAlliance. We're a connector, we're the global health connector. We've been around for over 12 years. We are proud to, as we talked about before, bring this community together, because that's what we do. We do, as a member organization, one of four things with our members. We have a member network of now well over 1,070 organizations, including many of the people on the call today from outside of Ukraine, and also the Ukraine Clusters Alliance. We bring those together in ecosystems like this, the meeting we're at today. This is an ecosystem gathering, bringing together those stakeholders together. Our understanding of ecosystems is quite basic. They're permanent multi-stakeholder gatherings, bringing all the stakeholders of health together. They're breaking down silos. They're creating economic opportunity, and they're transforming healthcare. What that means is we're able then to match need and solution, just like we've heard about from Alexander and from Tatiana and from the Ministry of Health. Where there's need and where there's some solutions, either within a country or externally. That's also done by, as I said, four pillars of our activity. And I'll give you examples of how that happens. So we connect our members together. So we literally will connect up one ecosystem like the medical clusters with another medical cluster, whether it be in Wales or Scotland or Argentina. We also connect up our members together so they can better understand each other, whether that's within other ecosystems or other events, or in projects, as we heard about before. So some of the great opportunities that are there within the EU for Health programme and other funding opportunities. So we work very closely with our members in funding programmes as well. And then lastly, we've also got that great opportunity to connect people up individually. So there's 23,000 people sign up to our newsletter, which offer an opportunity to make those connections, that global network. We also convene our members together, whether that's in ecosystems like today, or in some of our flagship events. So we would love to showcase the medical clusters that you talked about, Tatiana, at our upcoming event in Health in Las Vegas, where we're partnering with Health, where they bring together over 10,000 attendees in Las Vegas in October. I think the Ukraine Clusters Alliance should be there, because that's the best way to get engagement and connection, certainly within the US market as part of our global village there. The other way, as I said, we do that is in projects. So many of our ecosystems, whether they're Montsey or Yon Gorley you were talking about before, or Delith in Wales, they get involved with funding programs. And that's a great way to bring people together. So there's ecosystems, there's gatherings, there's events, and there's projects. We also amplify what happens. So we've been very, very pleased to be able to amplify the messages, the needs from the Ukraine Clusters Alliance throughout our network, through our newsletters, through our social media, because that's a strong way we can connect. So we amplify our members to each other, whether that's on their needs or their solutions, because that helps people understand what it is what it is you need, but also what it is, you've got in terms of solutions to accelerate outside. And then lastly, we accelerate the adoption of innovation from one region to another, one country to another, and more recently, one continent to another. So again, that's using some of our ecosystem networks, our events that we have, these flagship events, to be able to broadcast what you do in Ukraine and showcase the best in show within Ukraine. That network, I just like I mentioned, somebody keeps raising their hands. Unfortunately, we're not able to bring in other input, so unfortunately, we're about to include you. That network is now growing, and today we've launched our first ecosystem within Ukraine with the Ukraine Clusters Alliance. That's a network that's spread across the globe, whether it's from Argentina or to Zimbabwe, or all the way around the globe again to Australia. We're very, very strong within Europe, which is great if you're wanting to get involved with European projects. But we've got some exciting ecosystems in the US, in Canada, in the UK, in Australia, in Africa, in India, in Sri Lanka, all of whom are worth connecting to, because they will be able to help, and they will also be able to also buy. Because one of the things I learned when I got involved with the Ukrainian Health Clusters Alliance is that there are great export opportunities from Ukraine. These are fantastic because what they offer is to be able to put Ukrainian goods on the market. And so you can look at this network as a giant sales network for Ukraine. These are landing zones for each one of you, whether it's in Romania, in Transylvania with Yon Gorgi, we're going to go to in a minute, or it's in Wales, in the UK, or it's in Catalonia, in Spain. We've got those connections there to be able to help you export as well, which I know is vital. We've also got a network of thematic ecosystems. So that's where our network is. You'll see on the bottom of the screen a QR code. If you want to join us, you can scan that QR code on the bottom of my screen, and that will help you then join the ECHAlliance. If you're a not-for-profit or government body or a hospital, joining our network is free. That's an opportunity for you to amplify and raise your profile outside of your country within our network. You can also connect with us, and I'll put a couple of links in the chat function in a minute, via LinkedIn, or you can personally email me and we can send you some information out about us. That's enough for me. I want to keep my slides really short, because what I want to be able to do now is offer the opportunity now for Olga to tell us about that increased internationalization. Olga's got a fantastic challenge. She's going to win a competition today by presenting the most slides, but in the shortest time. Olga, the challenge is yours.
Thank you so much. Thank you so much. But don't worry, I'll take my 10 minutes or even less. So thank you so much for the opportunity to talk to all of you. And definitely there are a lot of things to talk about. And yeah, that's why actually there are so many slides I have, at least to, to have a feeling and overview how many work was done. And just to start with, why? Because in the beginning of 2022, in the beginning of March, and actually in February, all of us made our choice. And this is exactly our strategic goals right now. What we would like, that is why we do, because actually yesterday I had a meeting with the president of International Trade Council, and he asked me, why did you organize this Ukrainian Cluster Alliance? This is the reason why, because we choose our future, right? And we want to be a part of European Union and definitely to part of a single market. So this is the reason why. And what we did, of course, as far as, when we see the strategic goal, it was not a question of money or, of some benefits, personal benefits. So all of us were just starting to work for our community, for our society, and for our future. And exactly because we do know how big impact we will have for our Ukrainian economy. I should also say that Ukrainian Cluster Alliance, just from the beginning, we became a member of the European Cluster Alliance and active member of European Cluster Collaboration Platform. And we were probably the first organization which declared during EU cluster talks that declares that Ukraine and Ukrainian people needs not only water and solidarity support. We need business support. We need business-to-business support. We need work. We need contracts. We want to feed our people because they're working. And moreover, I also would like to add that this is also one of the freedom to have possibility to work. And now I realize that I'm speaking English, so I will press to speak English. Or should I switch to Ukrainian? Just let me know, because I'm sorry, just jump to. Okay. Yeah. Можливо, я просто перейду на українську мову. Перепрошую. Просто пригнула зі своєї презентації. Але дійсно мої слайди є англійською мовою, і це саме те, що я на що хотіла зробити акцент, чому ми стали це робити, як це все організувалось і як багато ми зробили. Дійсно, з самого початку, я маю на увазі з березня 2022 року, ми працювали разом з Ukraine and ECCP платформою саме з Marketplace ECCP. І саме кластери, яким чином кластери, європейські кластери допомагали. Але я також хочу сказати, що з самого початку ми зайняли таку активну позицію, що саме Україні потрібно працювати, потрібно роботи. І саме тому наші кластери поставили це як один із пріоритетів саме програми інтернаціоналізації.
One of the priorities that we have to have internationalization programs.
ми взагалі, ми почали допомагати нашим кластерам і нашим компаніям інтернаціоналізуватися. Олександр вже показував, що дійсно у нас була розроблена така програма по експорту інтернаціоналізації, але питання в тому, що ми не просто розробляємо документи, розумієте, ми дійсно працюємо, ми дійсно щось робимо, а документи є, таким supporting, я б сказала, такі програми, які допомагають нам рухатися далі. Також хочу сказати, що саме інтернаціоналізація – це дійсно не просто ефорт. Це дійсно така наша стратегія інтеграції, розумієте, щоб наші кластери, наші компанії, які є членами наших кластерів, наші організації, наші інститути, наші стартапи також інтернаціоналізувалися і рухалися далі. Є також декілька прикладів, і я можу сказати, що кожного місяця ми просто навіть не встигаємо всі наші івенти вставити в анонси, в пости і розповсюджувати інформацію про ним, але дійсно стільки було зроблено, і це перший івент такий глобальний, який відбувся разом з ITC, це якраз Global Forum Impact Forum on Ukraine. Щодо фактів, і за 22 рік саме по інтернаціоналізації ми мали дуже багато онлайн-мітингів. Це дійсно 300 мітингів, які ми мали з іноземними партнерами. Для чого? Саме для того, щоб пророщувати наступні кроки. Дійсно, ми на робіті, і вже до мене спікери казали, що ми зробили за минулий рік. Це навіть більше, ніж було зроблено за минулі 10 років. Тобто ми зараз рухаємося до інтеграції до Євросоюзу такими дуже великими шагами. В нашому випадку Український кластерний альянс дійсно використовує всі можливі, я не можу сказати, що це інструменти, а дійсно всі можливі програми, які надаються European Cluster Collaboration Platform і нашими колегами саме з цього. Хочу також зазначити, що вже в квітні місяці ми почали робити такі міжкластерні івенти, а також матчмейкінгові івенти між нашими компаніями і іноземними компаніями, але разом з кластерами. Ми виходили кластер і члени кожного кластеру приймали участь. А також як наступний шаг крок інтернаціоналізації ми приймали участь в B2B матчмейкінгових платформах, їх дуже багато, дійсно, за минулий рік було. І вони саме принесли також користь. Бо деякі, наприклад, Speed-Match, саме там я познайомилася з керівником Штутгар. Після цього у нас була сумісна конференція, після цього у нас був матчмейкінг між компаніями. Всі ці відносини, вся ця інтернаціоналізація, вона не відбувається одночасно, вона не відбувається прямо за один раз, але це ті кроки, які треба робити, інакше це просто, ми просто не схватимо нашу можливість, яка зараз відбувається. Кількість конференцій, форумів, вебінарів за минулий рік і за ці рік, це дійсно дуже велика, але я ще раз хочу підкреслити. Ми вже почали це робити з березня, і в квітні ми вже були на такому, знаєте, я б навіть сказала, на дуже потужному русі. І ще раз хочу сказати, без жодного співфінансування з боку держави або інших донорів. Далі я буду просто клацати картинки, саме тому, що показати кількість івентів офлайн і онлайн, в яких ми приймали участь. І дійсно, ми просто не відвідували, це були окремі сесії для України, окремі делегації від України, і дійсно саме це, розумієте, дає такий перший поштовх для наступних кроків. І саме в цьому я бачу дуже велику користь і Українського кластерного альянсу, яким цим займається. SME Assembly, Trade Mission to Europe в Талліні, так, була велика делегація
There
в
was a big
Штутгарті
delegation there in
Global
Stuttgart Global
Connect.
Connect.
Ну і дійсно з дуже
And
великою любов'ю, я дуже
also with
рада,
great
що зараз Монсі
love,
разом з нами.
I'm
Це
happy that
була
Monsi
її
is with us. It
ініціатива. До
was
речі,
her
також вона,
initiative, by the
ця
way.
ініціатива була після нашого
And this initiative was after our
окремої
separate
секції на
section
European Cluster Conference.
at
І після
European
цього
Cluster
дякую
Conference,
дуже
and after
Монсі,
that,
вона
thanks a
організувала
lot
для
to
нас
Monsi.
і
She organized
запросила
for us,
наші
and she
медичні
invited
кластери
our
на
medical
кластер
clusters
Exchange в
to
Барселону.
clusters exchange in
Дійсно, все
Barcelona.
це відбувається,
So all this is
і
happening and
зараз.
happening now.
Все це відбувається також
All this
і
is
на рівні
also
кластерів. Як я
happening on the
казала,
level
ми
of
всі
clusters. As I've been saying,
використовували
we used
можливості
the
European Cluster
opportunities of
Collaboration
European Cluster
Platform. І
Collaboration
дійсно,
Platform,
оцей кластерний
and this
Exhibition, який, до речі, ми
in which, by the way,
ініціювали,
we
це не просто нам
initiated.
хтось
It
запросив і
is not
сказав, а
just
ви не
somebody
хочете
invited us
таке
and said
зробити?
that,
Ні. Ми з
don't you want
самого
to do
початку
it?
займали
No, since the very
проактивну
beginning we
позицію.
were
І з
proactive,
самого початку, як ви
and since
бачите,
the
нам
beginning, as you see,
дійсно це в цьому була допомога з усіх боків, але ще раз хочу підкреслити, це також великий наш труд з нашого боку. Наприклад, це якраз на фото, це підписання меморандуму з 5 країнами, які також ініціювали ми. І Олександр Юрчак сам навіть писав той текст, потім узгоджував з усіма партнерами. І це також наша робота, яка не була ні для якої галочки, ні чим нам запланована. Саме на цій конференції, на цьому мітингу приймало участь більше 200 учасників, і дійсно наших українських кластерів було більше 20 онлайн і офлайн. Окремо також хочу зазначити, що була запрошена на представляти українські кластерні альянси, український бізнес на Ганновер Месе, але на саме стенд Європейської комісії. І для нас це велика честь. Це не кожного, мабуть, запрошують, і також, знаєте, наша можливість показати іншим, що у нас відбувається, що відбувається в наших кластерах. Сумісні конференції, сумісні виставки, на які ми зараз готуємося, а також співпраця з EIT, все, як вже казалось до мене, відбудова нашої екосистеми, відбудова нашої екосистеми як загальної України, як загальноукраїнська, збудовану в європейську, бо ми не хочемо бути якось збоку, розумієте, ми дійсно не хочемо бути в позі просителів. Ми хочемо бути партнерами, і саме цю позицію ми займаємо з самого початку. Бо Україна має свої можливості, має рішення для наших іноземних партнерів і має дуже великий потенціал для того, щоб бути дійсно рівним партнером. Саме тому дійсно ті самі наші драйвери, про які я також казала ще на європейській конференції кластерної, які є основою індустрії 5.0, той факт, що саме це було нашими драйверами з самого початку, це все ж таки human-centric, наш resilient бізнес, але також і sustainable бізнес. Саме це є нашими драйверами зараз і нашою позицією на майбутнє. Ще раз ми хочемо бути партнерами, і саме в цьому наші дії по інтернаціоналізації допомагають нашим кластерам і компаніям. Дякую за увагу. Ну і ми завжди раді подальшій співпраці.
Excellent. Thank you, Olga. Thank you for keeping to time. I'm conscious we're running slightly late, so we're going to move outside of Ukraine now and think about some of those corporations. So we're going to jump on a jet plane and go to Wales, where I'm going to line up Delith. Then we're going to go to Catalonia and then ask Monse to come and speak. And then last but very no means least, we're going to go to a close neighbor in Romania and listen to Ion Gheorghe. Delith, The floor is yours.
Thank you, Andy, and thank you to everyone. I'm absolutely thrilled to be here this afternoon. I'm the programme lead for the digital health ecosystem in Wales, and Wales being a country within the UK. And we're actually currently celebrating our 5th birthday. So it's really lovely to be here with you at your launch. And I'm really looking forward to engaging with you and hopefully having some of those collaborations and those discussions that have been discussed already this morning as we go forward. Ourselves, we're an arm's length body of Welsh Government, and we exist to catalyse innovation and collaboration between industry, health, social care and academia. And our strategic aims are really simple. It's to improve health and wellbeing outcomes for the people in Wales and improve efficiency and value within the health and social care system and drive economic development through business growth and jobs. And I'm going to talk about just a couple of the things that we do within the ecosystem that I thought would be relevant and interesting to yourselves today. One of the things that we do really well is our UK and international engagement. And really external engagement has changed considerably because of COVID and really that loss we had of face-to-face events. But it gave us so many opportunities through remote attendance, exactly like we're doing today, where we can speak at international events. And for us, that's where I think our relationship with ECHAlliance has really opened up the globe for us in a way. ECHAlliance has provided us with a platform for connecting with a wide range of stakeholders in the digital health ecosystem, including businesses, researchers, healthcare providers and policymakers. And for us, being a member has really facilitated our networking opportunities. It really helps us foster collaborations and partnerships with other organisations, both nationally within the UK, but also internationally. And this has all led to knowledge sharing, access to expertise and synergies with stakeholders in different regions, all with very different but also similar challenges. We've attended many ECHAlliance organised events and the workshop both virtually and in person. And these events, regardless of how they're held, are always very participatory and members can share their knowledge, experiences and best practices. I think what's really wonderful is that these interactive sessions really focus on emerging trends, the innovative solutions that are out there, but also policy developments in digital health as well. So for us, being a member of the Alliance has really helped us stay informed about the latest advancements, research and policies on an international level, but also it's enabled us to inform people about what's happening on the ground with us in Wales. And on a local level, we have many different projects, and we've got project leads within our organisation who can provide that project management support within our health boards or within social care. But they coordinate between industry, health boards and academia, just making sure that we have all the correct project documentation in place, make sure that we've got all the governance being undertaken when it should be, following up on evaluation, and they're just that added bit of resource for a project. And we've got some absolutely fantastic digital projects that are ongoing at the moment. For example, the accurate assessment of pain in some individuals presents healthcare staff with challenges. Most of us rely on the fact that we can verbalise our pain. And what can be really difficult is for people who are in maybe patients or residents in care homes who cannot verbalise easily or whose verbal communication fluctuates, and this is problematic. Paper-based assessment tools have existed for a while, but they do rely on training and correct interpretation from the healthcare provider, and additional time is also required to record the findings in healthcare records. So we're working with a company which is an app-based product using AI to interpret the results and holds that additional ability to transfer results directly to patient electronic records where available. So basically you use an app to scan the patient's face, and the AI uses facial recognition technology alongside a question set, which gives you a pain assessment. And this project in Wales has been used in care homes with patients with dementia who are unable to communicate effectively that they're in pain. And this tool supports that effective pain relief, and we're seeing a decrease in medication and hospital admissions. We also had a fantastic remote cardiac monitoring pilot funded through Welsh Government, and patients were given wearables and were able to monitor their condition from home, sending their stats through to a specialist nurse using an app. And this app meant that patients were then discharged from hospital quicker, medical optimization was quicker, and medical compliance was also increased. So there's some great things that are happening, and we're really happy to be able to share that. The other things that we do, we work really closely with industry, and I absolutely love hearing from the art of the possible and finding out what people are doing and sharing that with people. So we've got lots of information on our website, and I'm sure we'll be able to share the links to our website. I'm on LinkedIn, and if anybody would be keen to explore the possibilities for collaboration with us in Wales, we'd be more than happy to do that. And I'd urge you to sort of reach out and get in touch with us. That would be fantastic.
Thanks, Della. Fantastic opportunity. Just so you know, we do a publication each month, Ecosystem of the Month. Wales have been Ecosystem of the Month 2 times. There's a reason. Okay, let's go now to Catalonia. I want to hear about Montse. And for Montse, tell us what you're up to in Biocat, because I keep hearing about you.
Well, I think it's a lot of energy, probably. That's what I feel. But thank you very much for these words, for the invitation to ECHAlliance, to the Ministry of Health, to our friends in the Ukrainian Cluster Alliance. I thank also Tatiana for the words she said. I just feel the opposite. You guys are the strong women, and that's why I always keep these memories of that week in Barcelona. I'm going to talk about that very briefly also because I feel that I have to refer to that. But I'd like to share with you 3 lines. One is to celebrate our network, and ECHAlliance is really a fueler there in this network. The good projects and the memories together. There are friends here. Ion Georgi also will speak after me. I will try to be very short, very, very brief on that regard. Share what we've learned. It's our duty as partners to share the good and the learnings and how to try to complement what my colleagues have already said, and refer to an example of collaboration that I think would be a next thing to do with Ukraine as well for the ecosystem. So I will try to share my slides. I also have many slides, but I'm trying to do it very shortly. So first, I'd like to, like I said, refer to this week in Barcelona. That was a pleasure having so many friends there. But it was taking the profit of having so many different projects at the time. So having people from different projects and putting them together was an experience. And that I think we felt like very, let's say, generous, but it's not good to talk like that about oneself. But in terms of putting them together and see what happens and the opportunities that can also come among them, not necessarily connected to us. So that's one very nice experience we had in February this year. So that was 1 week of dialogues, of visits to the ecosystem, of changes with these 5 clusters, medical clusters of the Ukrainian Cluster Alliance, study visits and co-creation on which are the, and it was on 14th February, so we call it Fall in Love with Innovation. And that's because we really love innovation and we try to find which are the main challenges. And I remember very well Victoria saying, okay, our challenge is our young people. So those are things that are going to be in my memory for years, for sure. The cluster exchange was the framework of this week, and that was the very first day I met my friends from Ukraine, and I keep that also as a good memory. Just very shortly, some days of presentations and also meeting the ecosystem. So it's about meeting a little bit of everybody and seeing how it's done there. And those are our visitors, Olga, Victoria, and Olesia, Tatiana, Anna, and Natalia. So those are friends. So what we tried to show or to connect these friends at the time was this 1,300 companies in Catalonia devoted to life sciences and healthcare in general. And this is like an overview of the ecosystem. This is an image of our bioregion report. They were there at the time in the presentation of this report. And it was just to highlight how important this sector is for the region. It's almost 9% of Catalonia's GDP. And it's the second sector in turnover, innovative sector in turnover in Catalonia after ICT. And just as a reflection, digital health companies, what an ecosystem needs is fuelers. You need fuelers, and this is where I share some of our learnings, of course, and things that we feel that are good to share when we talk about building ecosystems. Of course, talking about fuelers, about innovation catalysts, and those would be the innovation catalysts, the companies, startups, large companies, even investors, technologies that can be taken to commercialization. And in this, also in this pathway, and the previous one was to see what are these companies that work in digital health do actually. Some of them are consultants, some of them work on clinical trials. Catalonia is really strong in that area. So of course there's a landscape for them there, but also health and wellness apps, consulting, etc. So this is not a landscape. Forget about probably the logos, but it's the distribution of ideas that is also what I wanted to share now with you. It's also important to have this strong research on or innovation also on deep tech, on AI, on virtual and augmented reality, blockchain, the digital therapeutics. So this is a little bit what we are boosting in this ecosystem or trying to, but there's also, of course, these fuelers, like I mentioned, the universities, the hospitals, the consumers, actually, the patients, the hospitals, the research institutes, having conferences and fairs. I forgot to mention that the first ingredient that an ecosystem needs to flourish is peace, and we really long for that very soon. So we can build that together with our friends there. So again, clusters and associations. The role of clusters, I think, it's key to connect, to be drivers of all those roles, the fuelers, the catalysts will have. Of course, having support programs, business acceleration programs. Some friends here that, for example, young Georgia will probably speak also about that, because having the accelerators and the support to these catalysts as a priority is key. They need resources, they need money, they need talent, but also data. If we talk about digital health, so these networks, those are really important. Then, just as fuelers, or we can call them also catalysts, you have the network of investors, VCs, that have to be connected also internationally. That's very important for the ecosystem as well. And having someone with a strategy to bring from the knowledge or from the generation of the idea of the knowledge, the startup, the product to the market, having the patient in the center and having some market access strategies as well. So this is what we in BioCat tried to do. I mean, we were created in 2006. We've been doing, I was there at the time, so I feel like very, historical, let's say. But so the first thing is, okay, you have this organization that tries to identify which are the ecosystem challenges. And for most of us, the challenges are business consolidation, of course, adopting the technology in the health system, mobilizing capital, talent development, and tech transfer. With those needs, you put in place programs and for example, that those were mentioned also, the programs to support the businesses or the talent or the investment. But now we have, and I wanted to share that with you because these are also some of our learnings. When we talk about what in the European framework, we see a lot of policies, relevant policies that are impacting the health ecosystems with programs, with funding, with initiatives. And of course, we need to be greener, more digital. Also, Europe has to be sovereign to face the challenges of tech dependency, for example, prepared Europe for next, whatever it comes, resilient, and having this Europe of health working in the framework of integration, patient centricity, etc. We have built like a framework for, or like a, let's say, a field of play for our ecosystem. We want to refer our ecosystem as also involving the international sphere, of course, but with research and academia, the research centers, universities mentioned as catalysts or fuelers, or depending the role they adopt at a certain moment. The entrepreneurship, also companies and associations, society and policymakers, healthcare, of course. But now this has to transform a little bit when we see which are the next challenges. We talked about the old ones, but now we have the twin transition, digital and sustainable, the tech independency that we have to pursue, the social impact, the resilience of our industries, and the deep tech talent. Europe is facing like a goal to have 1 million deep tech talent people by 2027, if I'm not wrong. So that means a lot of effort to work on talent as well on the deep tech area. And our industries face this value chain recovery after the pandemics. With still some SMEs, more SMEs suffered of these disruptions, and this recovery is really important. The digitalization and telemedicine as a trend, advanced therapies and personalized medicine as a model, the circular economy as a need, and the financial sustainability. I don't know if that's a need or it's an imperative, because it has to be. So all those advanced therapies have to be accessible to all the patients, and that's a big challenge as well. We cannot do that alone, so we need partners. We already have partners. Like I want to mention here in Ukraine, we say one because it's like a big umbrella of the Ukrainian Clusters Alliance, but there are many of them there, but across Europe and across the globe. It's very useful to have a network of bioregions like the Council of European Bioregions. I'm happy to be the president now, but it's just because I really believe in this working in networks, like, for example, with this ECHAlliance, which we are members of the network as well. And why? An example, and this is my third line, the example, working for a certain project, EDA, which is trying to interconnect ecosystems for the adoption of European health data space. Again, our partners are from STAMBAT or from the Council of European Bioregions, or we work with Portugal there as well. So our goals in this project are mainly to take the chance of having Europe guiding, being the leader, because there's a unique opportunity to exploit the power of data for healthcare and for research and innovation. So our goal there in this project is helping Europe being at the forefront and inspire the international guidance on health data space. We have some milestones already accomplished. We are working with the EU presidencies now as the Spanish presidency, and really believe that we will be advancing on the articles and the literature of the European health data space regulation, because probably by the end of 2024, or probably before, we need to have some very clear idea on how this will be implemented and adopted. And just to finish, to be like a cluster organization that seeks partners, we try to offer the knowledge of the ecosystem players, a portfolio of projects, a network of excellence at European and global scale, and good practices. This is our value proposition. So I think that we all need a value proposition. This might be ours, and I think it can match many of your value propositions of the partners here. We always seek investors, but not only for us, because we want to also have this network grow and better support our stakeholders, of course, but have these partners for our projects and to increase our footprint, our influence, but at the end of the day, working for the benefit of the people. And I think I will leave that here, because that was my last slide, and I don't want to take much time, but I don't know how to stop that sharing.
That's wonderful. Thank you for that, Montse.
Yeah,
I can only encourage the links to come through straight to the. We will share all these slides after today, and share the slides from all the speakers today. I'm conscious of time. I knew we were going to overrun. We've overrun. However, our last speaker is ready. It's none other than Gheorghe Petrovai from our Transylvanian ecosystem, who will help connect up some dots. Ion, the floor is yours.
Hello, everybody. It's a pleasure to speak after so many people that mean a lot for us as an organization for our ecosystem. Can you see my slides properly? Okay.
Yes.
So it's not by chance that the organization is called Fresh Blood, and everybody needs a little bit of fresh blood in these complicated times. And it's a pleasure to talk a little bit about what we do, what are our evolution, and was very impressive to first of all see that BioCat is 15 years. Now we are almost 7. Looking forward to grow as an organization. And for those of you that don't have too much, I fully invite you to come to Romania. It's Transylvania. It's actually the region. That's the name of the Transylvania ecosystem. The city is Cluj. Actually, I'm now speaking from Bucharest because that's sometimes you need to go to the capital to negotiate some things. But we are a city that is aiming to matter at national, at European, and at global level. A few words about our organization. It's called Fresh Blood, and our mission is to drive healthcare innovation and to accelerate healthcare innovation. And the 3 principles that we rely on is people, projects, and partnerships. We have been in this together with a couple of other organizations. The most visible one is ECHAlliance. However, it's not just about one organization. The ecosystem, as was mentioned by Montse before, it's complex, and there are a number of things that need to be aligned. However, we are not afraid of driving change, and that's a little bit the mantra that we have. And in this, we have been focusing on collaboration, Eastern Europe, Southern Europe. We are collaborating with university, collaborating with ECHAlliance. We are collaborating with medical clusters. We are collaborating with IT clusters, and we are collaborating, of course, with the ECHAlliance that we started to communicate 5 years ago. Almost 6 years ago, actually. And we found within the ECHAlliance a lot of people that matter and that provided the guidance. I've been recently reading a book. Probably everybody knows about the book Start with the Why. But I found another book which is called Not What, But Who. And everybody's saying what we are going to do. And this book, and I come to give it a lot of value to this book, is saying it's about who you are actually collaborating in order to make this happen. And in this context, we have a lot of people in the call that are very much the who people, starting with Brian, which was kind enough to visit Transylvania when we launched the ecosystem in 2018. It was Andy that opened us the opportunities and the vision, and this is already beginning to consolidate. And last but not least, Montse, which was kind enough also to mentor us on behalf of ECHAlliance. And this is, I would say, it's coincidence now. It's just correlation that you don't yet see. And connecting the dots, it's first of all, you need to have some dots to connect. And we need to have the local dots to connect. And we are very much about startups. And Fresh Blood, we started by helping startups grow in order to improve healthcare. And we have the events and the collaboration, and we have the own projects. But even more important is how you connect the people. And it's always about the people, that people make things happen. And just to give you an example, it's the Hub Vantage. It's our program supported by ECHAlliance, which is a founder mentor program, putting together healthcare startup founders, people from the table that earlier presented, and the healthcare mentors, because it's always a challenge to put people. Everybody wants multidisciplinary approach, but it's very difficult to put the engineers usually together with the doctors. So we need the table, and we were able to build this table. And this is just an example of this table. This is a picture that was live last year, somewhere in November, where we had the same table, people from the Regional Development Agency. We had people from the universities, people that were investor representatives, people from the startups. And at the end, we needed to have additional clarity. And this is why, for example, we invited Montse, and Montse was kind enough to visit us in Cluj-Napoca and to align the vision and transform the vision in actual activities that were able to support the development of the ecosystem. In this context, we are not afraid of moving forward, and we are actually, I thank you once again to Brian for the invitation, because suddenly looking back, you see sometimes the connections. You build them forward, but you actually monitor looking back. And I realized after the invitation that there are more than just borders between Romania and Ukraine. And we had actually healthcare connections. Romania also had a large population of refugees that either stopped in Romania or moved forward to other countries. And when this was happening a little bit over 1 year ago, it was first the local NGOs and the startups that stepped up. The government was later to move because it's government, it takes time. However, it's the NGOs and the startups that had access to Ukrainian-speaking nurses and doctors, because in the northern part of the region, you have a Ukrainian community of doctors. And we actually had this event calling Ecosystem Heroes, which was actually appreciating this. We have seen also on the slides that Olga earlier presented a number of things like EIT Health, EIT Manufacturing, EIT Jumpstarter. I don't think there is a chance that Fresh Blood is also part of EIT Jumpstarter. And we have been invited to help in the mentoring process, and we mentored 13, for example, through Fresh Blood, we mentored 13 Ukrainian innovation teams. And this was the first phase. Now is the second phase that will follow through. And this is also one way to use our experience, our opening to help the people that are willing to innovate and to impact both the ecosystem in Ukraine and the European ecosystem. Also, on one other slide of Olga, there was mentioned the cluster collaboration. I have seen Agro-Transylvania, which is also one of the clusters from the Transylvania. So Transylvania is present on several lines, and there are connections between us at the level of the local ecosystem. We remain open for collaboration. We remain open to exchange. There will be things happening, and already there is a big initiative and big collaboration setting up to help the rebuilding and the development of the Ukrainian ecosystem. Would be happy to help. Reach out to us. At the end, is just people. This is a picture that we have. We are based in several cities, and our device is very much ideas fail, people just grow. Or ideas might fail, but people will always grow. We are Fresh Blood, happy to help, happy to contribute. Please connect us to Twitter, Facebook, LinkedIn, and let us know how we could better help. Thank you very much. Ready to anything coming up our way. Thank you very much.
Okay, so thank you for that excellent example of an ecosystem that's everywhere, and before that, an ecosystem that's everywhere, and even before that, an ecosystem that's really, we say in English, moving beyond the borders with Wales, Catalonia, and Romania. I think I know we've overrun. I think we've had a fantastic first ecosystem event today. We've had some fantastic input from the European Commission, Ministry of Health, and from the Ukraine Clusters Alliance. But also, I can't forget input too from Montse from Catalonia, also from Delith from Wales, and Iongorghe from Romania. This is what we do. This is about connecting and convening people together in ecosystems. We look forward to the second one of these. And already I'm starting to think about what that could be, and the third one and the fourth one, because we could look at funding, we could look at internationalization, we could look at startups, we could look at the recovery plan. So let's look about how we can use that convening ability we've got to do this, hopefully keep a little bit more to time. I wanted to squeeze even more people in today, but some people said no, so I couldn't. But thank you for taking part today, and thank you for all the participants for your time, because this is about your ecosystem. And then our ability here is to be able to connect up, whether it's with Catalonia or Romania or Wales or beyond. I encourage you to think about coming to Health in Las Vegas. I encourage you also, I should be coming to you, Olga and Tatiana and Alexander, to talk about the UN General Assembly event we've got coming up. And also, I would invite you to come along to the Digital Health and Wellness Summit, which is going to take place in 2024 in the fantastic place called Barcelona. So we'll be in the 4 years from now event under the Mobile World Congress banner, and we were really pleased to showcase you there alongside Montseng colleagues as well. For now, I don't know, Tatiana or Olga, if you've got anything else to say, but I'd like to thank all our speakers for taking the time today, for my colleagues within the ECHAlliance for making this happen, because believe me, if it wasn't for them, you'd be talking to each other down the telephone. So thank you for Adriana, Inez and Iman for making this happen. And also for Tatiana with your speed and agility with colleagues there. This wasn't happening 1 month ago. So just think that from that 1 month ago, we got to this. We had nearly 250 people registered today, a packed house. Olga, Tatiana, any last words? Silence means assent. Olga.
Okay. Tatiana?
Ольга, можливо, перше, і я останні два
Olga, maybe you
речі.
could go first, and then I will have the last couple of sentences.
First of all, thank you so much for accepting us. Yes, it's very, very important for us, and it's not important just for today. It's long-term perspective and promising cooperation. Yes. We are really working for that, and this is exactly, you know, what we are working for, what we are struggling for, what we are fighting for. Yeah. That's why, again, thank you so much, and thank all of you. I understand that this is a small world, and this a system which we are
going to get smaller.
It seems that we are going in the right direction. Yes. Because most of ecosystem players are already known, which we didn't know a year ago or 2 years ago, and it's already a result. So I'm really happy that there are already some results in our way. Although all of us are looking forward for the biggest result for us, it's our victory. But we should also work on our part, on our front, on our place, which we are now. So again, thank you so much. For us, it's really important. This is really what we are fighting for. Thank you.
Thank you. Thank you. Tatiana?
Да, я українською, якщо можна, тому що, знову ж таки, більшість наших слухачів, які приєдналися сьогодні до нашого вебінару, це саме українські лікарі, головні лікарі лікарень, керівники департаментів охорони здоров'я. І ми дуже раді, що змогли привідкрити разом з нашими європейськими партнерами, які мають величезний 20-літній досвід розвитку медичних кластерів, привідкрити, а що ж медичний кластер може зробити, яку спільноту побудувати для того, щоб розбудувати охорону здоров'я України. Нам дуже важлива ваша допомога, ваш досвід, ваша підтримка, ваше партнерство. Ви дійсно є таким дороговказом, як має розбудовуватися екосистема і що таке екосистема охорони здоров'я. Це не закупівля просто якогось апарата в якусь лікарню. Це дуже просто просте рішення для якоїсь лікарні, а це вирішення проблем пацієнтів, саме потрібних для них послуг, щоб вони були на якісному, хорошому рівні, сучасному, інноваційному. І це, звичайно, розвиток лікарів, або ж не тільки лікарів, але й середнього медперсоналу, щоб вони були мотивовані, щоб вони були навчені, щоб вони мали спільноту, щоб вони розвивалися, бачили перспективу своєї кар'єри і свого життя. А кожен пацієнт в Україні зміг отримати саме найкраще і саме сучасне лікування і вчасно. Це наша мета, мета нашого ресурсного центру медичні кластери. Це мета кожного нашого медичного кластеру, який існує. Тому я ще раз, вже навіть під час доповіді отримувала повідомлення, як приєднатися до медичних кластерів. Ми натхнені
was receiving messages how to join medical clusters. So once again, we are inspired by your work. I'm thanking once again to the Alliance to India for your prompting us to have this webinar, and also all those who would wish to join medical clusters have this opportunity, and we would be helping and we would be contributing to the sharing of the best European experiences for the sake of each and every patient. So I'm grateful. I thank you so much for this best kind of meeting, and see you soon.
Excellent. And with that, I will promise that we will have the second one of these before the year is out. We will be sending out to all the participants all the slides, the dates for the next one, other reading material, content from Monse, etc., but also a challenge. Let's get another one of these in the diary before the year out. And we remain committed to doing that. And we're really glad to see the first one today. Thank you very much. Goodbye.
Thank you so much.